So I'm pleased to welcome back Dr. Søren Estvold, class of 2018. He is currently a sports medicine fellow at Travis Air Force Base in California. Hi, Dr. Estvold.
Hey, thanks for having me back. I'm glad to be here.
We're happy you're back. And
Thank you.
we are also very pleased to welcome Dr. Tess McClenahan. She is a graduate from the class of 2023 and is doing an anesthesiology residency at Bay State Medical Center in Springfield, Massachusetts. Welcome, Dr. McClenahan.
Hi, everyone. Thanks so much for having me on this year. I'm really excited.
Thanks so much for joining us. You may have seen that we were also slated to have Dr. Jasmine Rivas join us. Unfortunately, she is not feeling well tonight and couldn't make it. So on behalf of myself and everyone on the panel, we wish her a speedy recovery. Before we get started, we thought it might be interesting to just do a quick poll of the people who are tuning in tonight and see if we could learn a little bit more about our audience. So just to kind of share a little bit about yourself anonymously, if you could check any of the boxes that might apply to you, a poll probably just popped up on your screen. We're curious to know if you identify with any of the following groups. Do you identify as gay or lesbian, bisexual, trans or non-binary, or do you identify as an ally? And if you want to just go ahead and respond to that poll, not required, but we thought it might be more fun to be interactive and learn a little bit about the people who are tuning in tonight. Okay. And we want to make sure that we keep this interaction really very interactive. So throughout this discussion, we welcome you to submit any of your questions to the panelists through the chat on whatever platform you're using to tune in tonight. So you can use the chat feature if you've logged in through Zoom or through YouTube. You can post your questions to social media if you're tuning in via Instagram Live or LinkedIn. But we really want this to be just a really good open discussion. So please feel free to submit your questions. And now we can launch in. I'm going to provide a few kind of background statistics before we get the conversation rolling. And the first one is, according to the Kaiser Family Foundation study, 1/3 of LGBTQ plus adults say that a doctor or another healthcare provider has treated them unfairly or with disrespect. And that's compared to about 15% of adults who don't identify as LGBTQ plus, according to the survey. So roughly twice the people who have been impacted by discrimination. LGBTQ plus adults were also more than twice as likely to experience other negative interactions during healthcare visits, including providers making assumptions about them, suggesting personal blame for a health problem, or ignoring a request or a question. So it's imperative for a physician workforce to reflect the population it serves. And according to a 2017 study for the National Library of Medicine, it indicated that positive role modeling by an increased interaction with LGBTQ plus physicians decreased both implicit and explicit bias among medical students towards the LGBTQ plus patients they serve. So no big surprises there. If you have a better representation within the medical community, that should reduce the discrimination and negative experiences of the LGBTQ plus community that they serve. But the research about LGBTQ plus physicians is really scarce. When we were planning for this live stream discussion tonight, it was really difficult to find current stats about practicing LGBTQ plus physicians. According to the Association of American Medical Colleges, they've only recently started to collect information about sexual orientation and gender identity for medical students. And since 2016, the organization has included 2 sexual orientation and gender identity questions in their annual matriculating student questionnaire and also their medical school graduate questionnaire. From 2017 to 2019, the percentage of graduating medical students identifying as bisexual increased from 4.2% to 5%, and those who identified as gay or lesbian increased from 3.6% to 3.8%. The number of graduating medical students who had a different gender than that assigned at birth increased from 0.6% to 0.7%. So clearly there's still some strides to be made. And to address that topic, we're happy to welcome back Dr. Søren Estvold. Dr. Estvold, can you tell us a little bit about your background, your journey to becoming a doctor, and why you think representation in medicine is important?
For sure. Yeah. It is crucially important. I knew that I wanted to be a doctor when I was like in eighth grade. And that's because my mother was a doctor. I saw her do some really cool things and it really inspired me. And growing up in rural Montana, I thought, I'm going to be the first gay doctor. I can do this. This is going to be my thing. And then I went to undergrad in Portland, Oregon, and I realized many people had beat me to that. And that dream was not going to come true. So what I kind of realized was that I had no role models to look forward to. I had nobody in my community in Montana to be like, oh, that guy can do it. He's already done it, which means I can do it. And so I brazenly thought that I was going to pioneer that for Montanans. But it also let me know that like representation is super important no matter where you are. As an out gay member of the military and a doctor in the military, I had no role models for that either. And so I think if you're in a position where like you can kind of shine your light and be that representation, somebody's going to see it. And some kid's going to look up at you and think, okay, I can do that. He did it. He was successful and he's loved in his community for it. I can probably do this. And so I think that's why representation is crucial everywhere you go.
Absolutely. And you touched on a couple of really interesting points, one of them being an out member of the LGBTQ community in the military. That's certainly unique. And we're definitely going to talk about the importance of mentoring and finding people who can provide critical support as you're training and establishing yourself as a physician. I was wondering if you could provide us, just for people who might not be familiar with your professional background, if you could tell us too just a little bit about going to medical school and the work that you did during your residency.
Yeah, for sure. So my career background, I went to UMHS, obviously. I started in 2013, graduated in 2018. And the military was not part of that plan. The vast majority of military doctors go through HSPS, which is like the kind of military med school route. And as a foreign grad, I wasn't eligible for that until I landed a US residency. And I started thinking about that route because actually my debt that I incurred from med school was so great. I was looking for a way to offset that. And so there's a direct relationship there. Plus, I have a twin brother who is in the Army as an officer, and I saw how well the military took care of him. And I thought, okay, I think I could do this. Like, he looks like he has a great lifestyle. Why don't we try this? And I went through this like 6, 7 month long application cycle to apply to direct commission in as an officer. And I did that at the very beginning of my residency. And so I had landed a residency in Georgia at Medical College of Georgia in Augusta in family medicine. And so I did that, and I signed on as an officer. And then the military was really sneaky about it. And they're like, we'll just give you money every month and non-contact you for 3 years. And then once you graduate, that's when we're going to get you and we're going to put you in one of our clinics. But then as I've learned to be open to opportunities that come your way, which was a very new thing for me, I started doing that like maybe 5-ish years ago. I applied for a fellowship in sports medicine. And I didn't even think that I was eligible for that because I thought the military just hired me to be a family medicine doc. And I was going to sit in one of their family medicine clinics and just do like general practitioner family med stuff for them. But then I found out I was open to a fellowship either in women's health or in sports medicine. And I was good at both. And I've always been athletic and I've always really enjoyed sports. And I desperately did not want to look at vaginas for the rest of my life. So I applied to the sports fellowship and I got it. There was only like 6 positions in the US. And I found out that there's only 36 Air Force sports medicine doctors currently. And so coming in as this like civilian resident, competing against with all of those other military residents for this spot, like I somehow landed it. And I don't want to say that I was the diversity hire But I think that definitely helped me by being an out physician. That was my superpower to kind of get in and be like, this is what I can provide for you. I also provide a different patient care perspective. And I think those things helped me in the interview process and helped me land on this sports medicine fellowship, which is really great because I graduate at the end of July, and then I get moved down to Lackland Air Force Base in Texas, in San Antonio, where I'll be doing just purely sports medicine for the Air Force and working with their athletes and their basic trainees. And actually, I won't be doing any family medicine care for them because there's such a need for sports medicine docs down there. So it's been a wild and crazy journey with left turns and right turns, as you guys have seen, as I've been presenting for the last couple of years. And so just kind of be open to those opportunities, and don't be afraid to be you, because and you'll end up in some crazy places, and it'll be really fun along the way. I think that answered the question.
Perfect. No, that's great. I appreciate it. Thank you so much. And Dr. McClenahan, you are our most recent graduate on the panel, graduating from UMHS in 2023. Can you tell us a little bit about your background, if you knew all along that you wanted to be a doctor, kind of your pathway to UMHS, and what it's like since you have started your residency?
Yeah, absolutely. So unlike Dr. Estvold, I did not know that I wanted to be a doctor very early on. But it's funny because both of my parents were in medicine. So I don't know if I just had that rebellious side of me when I was graduating high school, that I was like, I don't want to do exactly what my parents do. So I was actually a criminal justice major in college, which is so funny to think about now. But looking back, all the things kind of had to align perfectly to get where I am today. So it wasn't until my senior year, actually, that I did an internship at my state's medical examiner's office. So, like, helping out with autopsies and just so deeply learning the anatomy and the pathophysiology of things, that I just fell in love with the medicine side of it. And I was hooked. So I left my internship being, I'm going to go to med school instead. So I did end up graduating from my undergraduate college with my degree in criminal justice, but then I did some prerequisites to sort of prepare myself for medical school and get all the classes in that I didn't originally take during my first round of undergrad, I guess you could say. And so, yeah, and I got all my prerequisites. I applied to UMHS, and it was in 2019 that I started. So it was right before COVID. So I got a good like eight-ish months on the island before COVID kind of ruined everything for me. But it was really great. I got my anatomy class in on the island, so can't be too greedy there. And yeah, so I applied for my anesthesia residency and matched this March a few months ago. And I'll be starting, as Megan said, my anesthesiology residency in Massachusetts. So I'm really excited to continue the medical journey. And I would just want to add on to what Dr. Estvold said, just about representation and how not only just in medicine, but in every aspect along your career and your life, and how much the representation matters. Even, in different jobs that you take before medical school, during your undergraduate career, in the hospital when you're doing rotations, it all matters, and it all kind of shapes you into the person that you are becoming every day.
Perfect. And it's interesting talking about how you were studying something completely different before you applied to law school. I mean, it definitely underscores what Dr. Espvold was saying in terms of just the fact that changes are possible, and what you think you're going to do might not always follow that course, and just the importance of being open to new opportunities, which it sounds like both of you have done. And so I think that's very important to kind of highlight to everybody tuning in tonight. Thinking about being part of the LGBTQ plus community as a physician, I'll start with Søren, I'll start with you because you did your residency in the South. So one might assume that you were subject to maybe some prejudice or discrimination. Just curious, I'll start with you, and then I'll toss the question over to Dr. McClenahan also. But have you experienced any discrimination as a physician? And if so, how did you respond?
So And being from the South, I have to say I do love the South, and I had a nearly perfect time down there. And so I was kind of thinking on this question when you had posed it to us earlier, and I think I can kind of think of two major times that I did experience some discrimination that was like overt, like and in my face. When I applied for my sports medicine fellowship, our sports medicine faculty member, he was from the Air Force and he had just moved into our program, and he would do weird things. Like whenever I had transgender patients in clinic and I needed to check out my patients to him, he wouldn't see them, and he would have me defer them to another provider or another faculty member to check them out too, which I thought was really weird. At first I thought he was like maybe too busy or maybe he wasn't experienced enough in it, but it was like this like systemic pattern that he kept doing. And like he would even come to me like the day of and be like, oh, I see you have these two patients on your schedule, like please check them out with somebody else. And finally it got to the point where I was like, I had to bring it up with my program and be like, this is not right. One, it's like causing me more time in clinic, which I don't have, and two, he's a faculty provider. You kind of have to see everyone regardless of your beliefs. So that kind of like was weird at first. And then he started doing other weird things. Like when I applied for my sports medicine fellowship, did not write me a letter of recommendation. Like very much like told me in an email was like, I cannot do this for you, but good luck on your own, which speaks volume as like your sports medicine faculty member doesn't want to write you a letter. And also the one who's been in the Air Force, who knows everyone that I'm applying to, also doesn't want to write me a letter. And so that's kind of when it hit me. I was like, well, this might be a little bit more, this might be about me. And this certainly is starting to feel like it's about me now. It was a very sweet feeling when I did land that fellowship, and I didn't tell him because I knew we would eventually get back to him on his own. And so that was a very satisfying moment. The other time I experienced kind of more like medical discrimination was really weird. It was when I think it was right before residency, and was having some problems, and I won't get into that, but I had to go see a GI specialist who was like this like really famous surgeon at one of the hospitals in Augusta that's like right next to Medical College of Georgia. And I was going in, and he had clearly like looked in my chart and seen like what medications and everything I was on, and I was on pre-exposure prophylaxis. And he started asking me these really weird questions. And he's like, well, what's your CD4 count? And what is your HIV status? And like these like really kind of like in-depth questions about like HIV status. And if I was like knowing my counts and up to date on my counts and getting tested regularly, when like that was not related to what we were seeing at all. And all of a sudden it started just like, I got this like real creepy feeling like on my skin that I was like, he definitely thinks I'm HIV positive, which I'm definitely not.
Mhm.
And he was like getting upset that I didn't know the answers to these questions, because like obviously I hadn't been testing my CD4 count levels because I had no reason to. And he had a resident in the room who all of a sudden you could just see it like come on like a light bulb in her face, and she like whispers over to him and she's like, that's pre-exposure prophylaxis. He's like, that's like, and had to completely correct him. And then he kind of like paused and looked at me and like didn't apologize for any of that, but just kind of like switched what he was talking about. And I was just like, wow, you were wrong. You're not going to admit that you're wrong. And then you're going to act like you didn't just kind of mishandle and mistreat the situation.
Oh,
Um, so being the semi-petty person I brought up the fact that I do get regular testing, and I'm glad he noticed my medication regimen, which he had misdiagnosed. So
oh
it was
boy.
weird. Yeah.
Yeah, that's pretty terrible.
Yes.
So that's interesting because your discrimination story that you're describing is as an LGBTQ plus patient. So you've experienced as a
Mhm.
patient firsthand what it's like to be
Yes.
dismissed or not have someone like thoroughly look at your chart or understand like where you're coming from and your medical history and all of that. So as a physician, it's interesting that you've experienced that discrimination as a patient because you can really truly empathize with what a lot of people in the community are facing when they go in for healthcare visits.
But it actually did help me do better with how I interacted with my patients, because I could kind of level with them better and be like, I know this is nervous, like nerve wracking. I know you're nervous. I know this is kind of scary. Like, this is what I'm seeing from your chart. Is this what you're experiencing? Like, I could just kind of tailor it better to them.
Mhm.
Um, and I was just more aware of like this is probably what they go through with other providers, and I'm not going to do this. Like, I'm not going to
Right.
treat them like how I was treated. So it was a learning moment, I guess, in a very bad way.
Well, yeah. Interesting. Well, thank you
Yeah,
for sharing that.
yeah.
Dr. McClenahan, I know that you're very early in your career, but maybe just as a med student or throughout any of your rotations, have you experienced any kind of discrimination, and how did you respond? And if you haven't, have you had any positive experiences or surprises that you'd like to share?
Yeah, absolutely. I can actually answer both of those. So it was, I'm sure that especially Dr. Estvold can like attest to this, that you've probably just had some attendings that are like a little bit older and just kind of set in their ways. And you know that you're not really going to change their mind or maybe even not really open it up any more than what it is at the moment. So sometimes it just helps to be like a little bit lighthearted. And what I have learned from the experience that I'm about to share with you is that it's good to have people in your corner. And that for me, it was really helpful to have shared that part of myself of like, I am a lesbian and I do have a partner, with some of the students that were on rotation with me and also with some of the residents that I was on their service. I was actually on my anesthesia rotation, and one of the general surgeons, again, just like older, like he had been at this hospital for a really long time. He's probably getting close to retire, just, kind of set in his ways. And I have no idea if this information about me had gotten back to him or not. But he had made a comment about like it was getting kind of late in the day. And he turned to me, and he had a student on his service, so I'm not sure why he decided to single me out, but he turned to me over the curtain and he was like, well, just so you know, if you choose general surgery, like you better have a husband that's like, comfortable with making you dinner when you get home. And but then he left like 30 seconds after that. And it was kind of like, to me, I don't know, I let those things kind of brush off my shoulder really easily, but I turned to the anesthesia resident and both the surgical resident who both know that I'm a lesbian. And I just said, well, the chance of me going into general surgery or having a husband is about 0%. So he's wrong on both of those things.
Yeah.
And so like, and they were able to kind of like laugh about that with me too, because like I said, I had shared that part about myself with them. So yeah, it was just, some things you can let kind of roll off a little bit easier. So it wasn't anything that I don't think he meant, like super malicious comment, but just things like that that can happen. I surely hope that I don't have anything worse than that happen during residency, but such is life. I guess going off of the positive things, I've had the responsibility of taking care of a couple patients that had shared with me that they are part of the LGBTQ plus community. And just the extra, when you're a student, you get to have like that little extra time with the patient and kind of really just open up your ears that maybe nobody else is listening to them or their concerns just because, they're really busy or they're trying to get other things done. And so to have that little bit of extra time with somebody, I know has been super instrumental to them. I was stitching up a patient who had gotten into a car accident in the emergency department, and he was transgender. And I, just took my time. I was able to like talk to him through. He was very nervous. And at the end, he just thanked me so much. Like, I'm so glad that like you were the person that was here tonight and that you were the person that was able to spend that time with me. So as of now, the positive absolutely outweighs the negative in my experiences.
I'm so happy to hear that. And it's great that you were able to respond to that one situation with humor. I think that, no matter what career you go into, you're going to face those kinds of like, just very dated, kind of comments and, whether it's misogynistic or homophobic or,
Yeah,
so to be
sometimes
able
it's
to,
unavoidable, but it's like if you can just kind of roll it off, then sometimes that's best, other times it's not. But in that situation, I found that it was just best to kind of roll it off and, make a joke about not having a husband or general surgery.
right,
So don't
exactly.
worry about either one of those.
Exactly, exactly. It sounds like you handled that really well. Dr. Espvold, I was wondering if you could also share any kind of positive experiences or surprises. And then also I wanted to add kind of a second point to that, as a follow-up to what Dr. McClenahan was just talking about when describing treating her transgender patient after the car accident. If you could just add maybe some advice that you've shared from a past talk to let people know that they are in a supportive environment, just to let LGBTQ plus patients know that that they're going to be treated with respect.
For sure. And I was actually going to lead with that and give some advice to Dr. McClenahan. Wear something with like a little tiny rainbow on it. Like that's what I did all throughout residency. Like all of my scrubs had like a little tiny rainbow on the shoulder patch, or on my like badge reel and stuff, I had a little rainbow badge tag that kind of poked out. And people notice that, like people will clock that from across a room. And so many people that I treated, like whether in like the ER or on the floor or something like that, they would know that, and like they would just open up to you and just blossom in front of you. And that was such a nice experience because you could just see them relax, and they're like, okay, somebody like me is treating me. They understand a little bit more about me and can handle me better. And like those kind of moments like made medicine so much better, so much more fun, because you knew you were actually kind of doing something that was really impactful for your patients. And so just little things like that. Like now, like being in the military, I'm not allowed to wear as much like flare stuff like that. But like my stethoscope is like black with like sparkles on it. And like people see that, and like just like little subtle things like that. And there's so many times when I'm treating family medicine patients and they see it and they're like, they just kind of open up to you more. And I think that's so special because then you just give them so much better care. And they appreciate it because they don't see it coming and they don't expect it. I think they just have a lot of patients have this wall already built up that they're not going to have a great medical experience, or that they're just not going to connect with their physician as well. And when they get you and you can connect on that level, it provides such a better patient experience. So
Thank you for sharing that.
yeah.
Yeah. And then this is for either of you. If you have any advice for LGBTQ plus students who are applying to residency programs, how can you make sure that you're going into an environment that will be supportive and will be a good place for you to learn and grow? I don't know who wants to take that one first.
I'll let McClenahan take it since she just got through that system.
Yeah, sure
Okay.
thing. Yeah, I actually probably have a lot to say on this topic. The first place that I would start is when you're kind of figuring out like what specialty, or even if you're dual applying to maybe two specialties, is to kind of narrow down, the programs that you're going to be hopefully applying to, and which ones are a little bit maybe higher on your list compared to other places, whether it's location based or program based, what have you. And really start to dive into those residency program websites. And fortunately, a lot of those programs now are on social media. A lot of them have accounts on Instagram. So do yourself a favor and really look into those programs. Like, what sort of education are the residents doing? Are they posting things about Pride Month or, different events throughout the year? Does it seem like they're a supportive, environment to learn? Is it in, geography based? Is it in a place that you could see yourself living and that is maybe a little bit more open than other areas? So yeah, residency programs put a lot more out there than I think that they did maybe even like 5-10 years ago, especially with social media. And throughout your interview process as well, like, it sounds cliche, but you really can get a good feel about a program when you do interview. I think virtual is a little bit harder now, but I found that I could get a really good feel for programs, whether they were inclusive. And this is sort of a decision that you have to make yourself. And I know that not everybody would agree with the stance that I took. With that being that I was very open about my sexuality during the interview process and in my application. The way that I saw it was that if I was presenting sort of like this watered down version of myself to a program and I thought it was a good fit and they thought that I was a good fit for the program, I'm not really presenting my true self to them. So I might not actually be a good fit for that program. And on the flip side of that coin, my partner and I have been together for going on 7 years. Like, she's obviously a very huge part of my life. And so to not present my life in a way that she's included in that, just felt like That's something that I didn't want to do. And I think as members of the LGBTQ plus community, we get really good at reading rooms and what we want to share and what we don't want to share. And so, yeah, if you're in a position that you feel comfortable to share those things, I would encourage it. But I know that everybody has their own decisions to make during the residency interview process specifically.
Perfect. That's really helpful. And I think you're right. I think it's really important to present your authentic self so you're sure to get the right fit. That seems like great advice. Dr. Estvold, did you have anything you wanted to add to that?
Yeah, no, I think that was wonderful advice. I remember when I was going through the residency interview period, even my own mother was like, you should really try and be more like a WASP, like the white Anglo-Saxon Protestant, like just kind of like real conservative, especially when you're applying to programs. And I thought that sucks. Like that doesn't feel like me at all. But I know where she was coming from. She just wanted me to like get under the radar and land a program. And I didn't do that at all. I remember like just kind of like normalizing in my interview, like, oh, I would somehow like not name drop, but like drop that I had a husband or, talk about the fact that like I do a lot of like LGBTQ care and that's what I'm interested in, transgender health, and that's what I'm interested in, kind of like dropping those little keywords during your interview. A lot of people were like, oh, that's great, we actually have an LGBTQ like free clinic that needs like a lot of help, I'm really interested. Or they'd be like, oh, our program's trying to do more LGBTQ curriculum, it sounds like you'd be a great fit for that. And so that kind of like cues you into like, oh, this program really likes me for me and they're going to be comfortable with me. And then if I had a program that was like, oh, like that didn't really attach onto that, you kind of knew they were not going to be a great fit for you. But kind of like what McClenahan was saying, like, don't water yourself down. I think by being true to yourself, like I always say, like that's your superpower. That's what's landed me these great opportunities and made my career very successful. And I think if I had hidden those parts away, like I probably would have not landed in a great residency and not been in a fellowship and not had this really fun career that I've had so far. So like really just, I mean, it's scary, but like it's scarier not being you.
Absolutely. Absolutely. That's great advice. Um, and kind of along those lines, Dr. Estvold, you mentioned earlier the importance of finding a mentor or having like a role model within your field. So I was wondering if you could just sort of elaborate on the importance of finding mentors, if you have a mentor, how you found that person, just the benefits of it. And then I'm gonna kick that question over to Dr. McClenahan as well.
Yeah, I don't have a great answer for this because I never had a mentor. I kind of charted my own path. But I think kind of like don't be afraid to go after what you want. Like I think that's kind of the best thing. If you can find a mentor or somebody that you really gel with, like they're going to be so helpful. The military is really big on having a mentor. And so like my program director would probably be the biggest like form of a mentor in my life right now because he's so successful in sports medicine and knows everyone that he can help kind of guide you. Like he helped guide us along this path. But really like if you just like look around, like if you find someone on social media or someone else in medicine that you know that you just really like where their career is going and how they've handled their career, reach out to them and just, say like, what are like just 3 words of advice you can give me? Or what's your, 5-minute elevator spiel that you can give me on like how I can model my career towards yours. I actually met the president of the American Medical Association a couple months ago when he was at a conference that I was at. And like he his whole introductory, he had a video, like that's how like cool he was. It wasn't just like, hi, this is what I do. And he's out too. He's an out gay male who's the president of the AMA. I think he's an internal medicine doc. But like he was like listing off these like Emmy awards that he had won and these presidential like positions that he'd had and all these cool organizations that he worked for. And I thought, I have to talk to him. I have to somehow see like how he did this. Like this is amazing. And he's like probably in his early 40s. Like I don't know how he did this. And so I like literally bombarded him I waited till everyone else bombarded him. And then I was the last person to bombard him on his way out the door. And I was like, I know you don't have any time, but like, what's just like, first, how can I connect with you to like follow up on this later? And he gave me his business card. And then I was like, what's just like one piece of advice that you wish you had known 10 years ago that you could tell me? And he did. He took like 5 minutes as we walked towards like to his car about like what I could do next. And I thought that was like really helpful and really cool. And the fact that he used his platform to just kind of like pull me up just a little bit on his way up too, I thought was very special. Like it was a very like leadership quality that I kind of glommed onto. So yeah, so that's, go after what you want, go after what you need.
Very cool. Thank you. How about you, Dr. McClenahan? Do you have any advice on finding mentors?
I think that Dr. Estvold really kind of hit the nail on the head, but mine might be a slight variation from a mirror image of his. That, yeah, you really want to find a person or maybe a couple people that you just really appreciate what they have been able to do so far. And that could be somebody that's, just a couple years ahead of you in residency, or maybe newly graduated, or maybe they've been practicing for 25 years and have all this experience under their belt to kind of share with you. And yeah, I think it really just comes down to finding the person that has gone through the things that are coming up on your plate and can maybe give you a little bit of advice to navigate your way through it a little bit better than maybe you would have been able to do on your own. Unfortunately, the mentors that I have found, well, I shouldn't say unfortunately, I've had some great mentors through UMHS of practicing anesthesiologists that kind of really helped me throughout the interview process. And one of them actually wrote a letter of recommendation for me as I rotated through where he was working. But they are not part of the LGBTQ plus community, which, I mean, no problem. Had it been great if they probably would have had a little bit more experience to share with me. But kind of taking that is that I hope to someday be that person for somebody else that's going to be in my shoes. And a year, 5 years, 10 years, however long that it might be, that, I can offer the career advice, but then I can offer, this kind of words of wisdom or this advice on, this being navigating through as a member of the LGBTQ plus community as well.
That's a great response. And again, it goes back to what we were talking about at the beginning of the discussion, right? About representation and having people within the community that can be a mentor, and, be a great resource for answering any just, unique or special questions that you might have that might not apply to people that are outside of the community. So I think that's an important point. Just a kind of a follow-up question to that, Dr. McClenahan, is the most recent UMHS graduate. What resources, if any, do you have to share with current or prospective med students? Were there any groups on campus or any social media groups that you were a part of that were a good resource for you as a med student?
Yeah, sure. I can answer that. I might be a little bit biased on this club because two of my really good friends in my semester founded this club at UMHS, but the work that they did was incredible at the time that they were there. It's called Because We Care Club, and they're really committed to diversity, inclusion, and health education. So they kind of do events that span like any topic, but they have done events related to LGBTQ medicine in the past. I also got involved with AMSA. They put on a bunch of incredible courses. The ones that I did were on reproductive health, but they do so many different like courses on just, oh my gosh, anything and everything pretty much that you could want. They have either a current course or information on a past course that they've done. And then off kind of campus and off medical school, more in the online world. I think that I had mentioned this to Megan earlier, but there is the National LGBTQIA plus Health Education Center. This is basically like an online library of webinars and publications. And I think that this is like one of the largest databases for LGBTQ publications. So that's been really helpful. Just kind of reading up on things, or if I'm trying to reference something in my own work. And then I would also say Outcare Health. This one is perfect because it's free to students and residents. So it has modules and videos, again, about so many topics spanning LGBTQ education. And it also has a provider list of affirming healthcare providers too. So if someone is looking for a specific provider in their area, that's a great resource for them as well.
Perfect. That's really helpful. And I think that what we are doing is adding links to those resources in the chat. So anybody tuning in can access those links for more information, because those are great resources. So thank you for sharing that. Dr. Estvold, you also mentioned in an earlier discussion that you found a really supportive community online. And I was wondering if you could just kind of talk about that a little bit and any other resources that you found as a practicing physician.
Yeah, so not so many like educational resources, like those are all great that McClenahan mentioned. But one thing that I stumbled onto was a Facebook group called Gay Men's Physician Network. And it's for all like male identifying like physicians, whether you're like med student, resident, fellow, beyond. And I would say it's like one part networking and one part just like having way too much fun on the internet. And so it's a fun group because people are constantly posting in it. And like your posts are anywhere from like, hey, I'm not a derm, but like my patient has this weird rash, or like asking for a friend, but there's this weird rash. Can like anyone figure this out? And like people will dogpile on that and be like, oh, it's this, treat it with this, do this. And it's usually pretty well like corroborated, or they'll be like, I'm internal medicine. I have no idea what's going on, but like my patient has like XYZ symptoms. Like, where can I go from here? And people will like offer suggestions. So like, it's like this cool, like kind of like crowd surfing, like way of like medicine and just like networking and helping each other out. And then other times it's like really fun where people will be like, oh, I'm going to a conference in Chicago. Anybody there? And anyone want to like meet up for a drink or food? And people will like get together. So like I was in New Orleans for a conference, and there was two other guys from the Facebook page, and we got together and grabbed like a drink and some food, and like that was just really fun. So like it's a cool networking thing. You also see like med students are in it, and they're like, hey, I'm getting ready to graduate. Like I'm like pertinent to this talk, they'll be like, I'm LGBTQ. Like, are there any like you friendly programs that I should be looking at? And people will be like, oh, come to my program, or oh, apply to us here. And then even from like the resident perspective, like they'll be like, oh, I'm graduating soon. Like, where should I apply for jobs? And people will answer them there. So like, that's just been like really fun. That's probably like my best little thing that I've discovered, because it's just like a fun little social network that I didn't see coming. So yeah, so if there's something like that out there, like I'm sure you guys can find them, but like that just makes medicine more fun and more kind of a camaraderie thing.
That sounds great. Thank you so much for sharing that. Now, Dr. Estvold, you were mentioning that when you spoke with the president of the American Medical Association, that you asked what advice he would have for you in your career. And so now I'm going to pose the same question to both you and Dr. McClenahan, but what advice do you have for current or prospective LGBTQ plus med students who are interested in becoming doctors? What advice do you have for them? What do you wish you knew?
I wish that I knew it was okay to be me. And that's going to be the most important thing that's going to help me be successful in my career. I wish that I had somebody who would just tell me, who had told me, it's just be who you are, and this will open so many doors for you, and don't be afraid of that. Because so many people told me the opposite of like what McClenahan was saying, just water yourself down, try and fit in, be more conservative, and just land a spot. I think that's important, that it's important to know that it's okay to be you. Like it's okay. I think I posted earlier on one of the questions you guys asked, like be that sparkly unicorn for your department, and it will get you places. I've never felt more like a diversity hire since I got hired for the Air Force. Like landing in my fellowship, I was the only one like me. But one, it got me a job, and two, I could then use that position to make changes in like from the inside with them. And then the last kind of thing is like you have a platform now, like whether it's a small platform, it doesn't matter what your social media presence is, but like as a physician or even like an aspiring physician, people are going to start looking for you to like help them with just basic healthcare questions. And you actually have something to give back to your community. And I think giving back to your community is so important, whether like you can help volunteer for like HIV testing or help volunteer at a free clinic or even a general practice clinic. Like use what you have to give back to your community, because as the LGBTQ community, we need help in healthcare and you have a chance to do that. So I think that's just so crucial.
I love that. Yeah, I love the point that you made about making the changes from the inside and that you're in a position to make a positive impact. I think that's all really excellent advice. And of course, I'm always a fan of giving back to the community, and to do it with healthcare where it's sorely needed is just wonderful. So that's all very good advice. Dr. McClenahan, do you have anything that you want to add? Any advice that you have, especially just, as someone who's starting their residency and very close to graduating from medical school, what advice do you have for current or prospective med students?
Yeah, I think that this is really just kind of piggybacking off of Dr. Estvold mostly. But like he said, we need people like us and like you, and to really kind of build this community of medicine, and that you have no idea how valuable that you're going to be to yourself, to your patients, to your co-residents, to your attendings. I think that yeah, you really don't know how much value that you're going to add, and you have this extra toolbox of knowledge and, most importantly, compassion that you're going to be able to share with your patients who probably need it more than you know. And I think just what I wish that I knew going into it is kind of just really like a positive spin at the end, that the people that I met throughout my medical school journey, whether it was in basic sciences or my clinical rotations, have become such an integral and instrumental part of my support group, whether they identify in the LGBTQ plus community or they're an ally. I've just met so many incredible people, and it just gives me so much excitement and hope for the future, that kind of like what Dr. Estvold was saying, that we're going to be able to make some really incredible changes in healthcare and in medicine during our careers. And really, I'm just excited to get started.
That is very exciting. Um, and then the last question before we start sharing some resources, and just want to remind everyone tuning in that if you have any questions, please feel free to drop them into the chat. Just how do you take care of yourself? How do you make sure that you don't burn out? I'll start with you, Dr. McClenahan, since you're, again, fresh out of med school and starting your residency. How do you make sure that you don't burn out? How do you take care of yourself?
Yeah, absolutely. So I live in Maine currently, so a lot of my hobbies revolve around the outdoor scene, because there's not a lot of huge city and entertainment around. So yeah, just kind of really decompressing with things outside, whether it's like hiking or running or walks with my dog. I have a Great Dane, so she takes up a lot of my time, and she's very needy, but in that too, like I said, my partner's a huge, part of my life. So we do a lot of those types of things together that we enjoy doing. And really, I think that that's the best decompression, is spending time with the people that charge your batteries and kind of, don't really drain them. So yeah, I think it's just finding the things that you enjoy and doing those with the people that you enjoy being around.
Sounds great. What about you, Dr. Espvold? Any advice on how you practice self-care, how to keep from getting burned out?
It will happen to you. That's what I want to make clear. Like residency is very tough. I just came off of 3 years of it. I have an enormous sleep debt. And then I did another year of fellowship, which was even more difficult than residency. So you will be exhausted and you will be tired. So wrap your head around that. What I kind of found that helped was setting boundaries, and especially work-life boundaries. So like I do not take work home with me. I leave my work computer on the base at the office. And I like, fortunately in sports medicine, there's very few emergencies that like can wait to be handled. But I think learning to say no when people ask you to do extra projects and things, just say no. And you don't have to explain why. Like that's important. And then when you're at home, don't work while you're at home. Don't check your emails that are work related, or just like read the headline and move on to the next. I think that's so crucial because if I did not have those boundaries, I would be checking my email and checking patient charts while I'm trying to watch Bridgerton like with my husband, and like there would be no interaction between us. And so I think that setting those boundaries early and letting people know that like I'm off, I'm home, I'm not in the clinic, I will not be responding to work related emails. You can go to the ER if it's that bad. I think that's very crucial to set those boundaries. And then figure out what works for you. Like this weekend I went up to like my husband and I just needed to get away, and like I've been working a ton, and so we stayed at this really nice hotel that had a really great pool because all I wanted to do was sit next to the pool. And I remember telling him, I said, I'm going to put my earbuds in and I'm going to listen to an audiobook and I'm going to ignore you, and it's not coming from a terrible place. I just need to not talk to anyone. And I did that for like a good 4 hours, and that made me feel better. And then we went out to dinner and had a lovely evening together. But again, those were boundaries, and I communicated what I needed and took time for myself. And that's kind of what you have to do. I'm lucky enough that I have a support person. My husband cooks for me, he cleans for me, he walks the dogs for me, he takes my car to get gas and oil and change and whatever it needs. And I'm so lucky and privileged to have that like this job would be 100 times more difficult if I did not have that support person. So if you have a support person, just be honest with them. It's going to be very hard, and they're going to earn half of your medical degree and half of your fellowship degree because they're right next to you. And if you don't have that support person, find those little things that are going to make your life easier. Find someone you can pay to clean your house. Find someone who can help you, or use services like getting food delivered, like your groceries delivered, stuff like that. You have to set up things to make yourself easier because it's the going's going to get tough, but you can make it through it. So long story short, set those boundaries, but also take care of yourself and figure out what it is that your self-care looks like.
I think the discussion of boundaries is so important, and learning to say no. I think that was one of the most powerful things that I've learned in life, is that no is a complete sentence.
Yes,
and you
100%.
don't need to elaborate.
Love that.
So
Thank you for sharing.
Yeah. Well, this has been a wonderful discussion. We wanted to share some additional resources for you, for everybody tuning in. There are two really great organizations that have wonderful information about treating LGBTQ plus patients. I know that we dropped the resources into the chat that Dr. McClenahan shared earlier with the National LGBTQIA plus Health Education Center and also OutCare Health. But two other great resources for treating LGBTQ plus patients. There's the AAFP and also GLMA, GLMA. And we're going to drop those links into the chat as well. So you have those resources to look into.
Jump off of that real quick.
I'm sorry?
I said, can I jump off of that real quick?
Yeah,
so
please
you
do.
mentioned AAFP, and as a family doc, that is my number one resource that I go to when you have no idea where else to turn, and you just Google search like AAFP chronic cough or AAFP diabetes, and you can answer 90% of all patient questions with that. So if anyone's out there, and I don't know, Dr. McClenahan, how well it will apply to anesthesia, but when you're seeing like when your patients just have those everyday questions for you and you're like, I don't know why you've been coughing for 3 months, like that sounds terrible. But if you Google AAFP and then whatever, you will answer almost all of your questions. So like that will make you look so smart to all you med students out there and all of you residents out there. That's my gold tip for today.
Awesome. That was worth tuning in and staying till the end, right? Just for that. That's wonderful. And then Dr. Estvold and Dr. McClenahan were both also gracious enough to share their email addresses, which I think will also be getting dropped into the chat. So if anybody tuning in, I know we didn't get any questions into the chat, and I think probably two reasons. Number one, Dr. Estvold and Dr. McClenahan shared so much wonderful information that you didn't have any questions, or two, maybe you didn't feel comfortable dropping a question into the chat. So if you'd like to follow up with either of them individually after this discussion, you can contact them via the email addresses that are currently being shared in the chat. And again, if you want to go back and learn more about treating the LGBTQ plus community, there are some great resources on the UMHS YouTube page. Look under the live events page, and you can go back and find past discussions that are related to LGBTQ plus healthcare. But again, I just want to thank both of you, Dr. McClenahan, for joining us tonight. Dr. Estvold, we know that your schedules are very busy. We appreciate you sharing your insights and advice for everybody tuning in. Thank you so much for joining us.
Thanks, everyone.
Thank you. And thank you to everybody who tuned in tonight. And we hope you enjoy the rest of Pride Month and stay healthy and well. Thanks.